How does letrozole, Femara, induce ovulation for fertility? Imagine trying to get your body to release an egg, but your natural signals aren't quite working. That's where medications like letrozole, also known by the brand name Femara, come into play. Letrozole helps women who have trouble ovulating, whether because of polycystic ovary syndrome or other reasons. It works by changing hormone levels in your body to encourage ovulation. Letrozole is a drug that temporarily lowers estrogen levels. It does this by blocking an enzyme called aromatase. Aromatase is responsible for turning androgens, which are male hormones, into estrogen. When letrozole blocks aromatase, estrogen levels drop. Your brain senses this lower estrogen level and thinks your body needs to produce more. So, it signals the pituitary gland to release more follicle-stimulating hormone. Follicle-stimulating hormone is what stimulates your ovaries to develop and mature egg follicles. These follicles are tiny sacs that contain the eggs. As the follicles grow, they prepare to release an egg during ovulation. When the follicles reach a certain size, usually around 20 millimeters, the body triggers ovulation, releasing a mature egg ready for fertilization. Because letrozole reduces estrogen rather than blocking its receptors, it tends to have fewer negative effects on the lining of the uterus and cervical mucus. This is important because a healthy uterine lining and good cervical mucus are key for a fertilized egg to implant and grow. The short half-life of letrozole means it leaves your system quickly, which helps minimize side effects and supports a healthy reproductive environment. Doctors usually start letrozole on the 3rd, 4th, or 5th day of your menstrual cycle. You take it for about 5 days, which mimics your natural cycle and promotes the growth of one or sometimes multiple follicles. This makes letrozole especially helpful for women with irregular cycles, polycystic ovary syndrome, or unexplained infertility. In women who already ovulate, it can boost the number of eggs released, increasing the chances of conception. Because letrozole was originally developed for breast cancer treatment, using it for fertility is considered off-label. That means it's prescribed by a healthcare provider who can monitor your response and adjust the dose if needed. It's a targeted approach to help your ovaries produce a healthy egg while preserving the environment inside your uterus. In summary, letrozole induces ovulation by lowering estrogen levels through aromatase inhibition. This signals your brain to release more hormones that stimulate your ovaries to develop and release eggs. It's a helpful option for many women trying to conceive, especially when natural ovulation isn't happening.